lunchtime. No salad today. We're having leftovers. Rice, which is fried rice that I made last night, and a lamb curry that was left because hubby didn't want to have dinner last night because he'd been snacking all day and said he wasn't hungry. So that's lunch with, of course, yogurt, Farmers Union yogurt. So I'm going to eat my lunch. I'm not going to eat and talk to you because that's kind of gross. So I'll eat my lunch and then come back, and I've got so many things to talk to you about. What should I talk about? I'm feeling like I have to do like a recap of the surgery, the breast reduction surgery, what it costs, the complications. So I think I'll talk to you about that in this video. I'll eat my lunch, I'll come back and I'll tell you about, I'll have a look at my computer so I can actually give you the actual cost of the surgery. In my mind, it's about $20,000 out of pocket, but I can do better than that, tell you the exact number. So I have my lunch, we'll be back in a minute. Okay, so I've looked at my computer and my bank statements to show what I've paid. The surgeon I had to pay up front. So even though I had complications after the surgery, the cost is the same. It was $15,999, so say $16,000. The anaesthetist I got a bill for after. I got a quote in advance, which I agreed to, and then I got the bill afterwards, which was $4,625. The hospital costs for 2 nighs was $7,466. It was a private hospital, but because I have insurance, then I only had to pay $500 out of pocket. Very bad image, but you can see these are the costs for the hospital, and then all I had to pay was $500, which was great. Pathology, $306.80, and medication, $50. So all up, $21,480, which was out of pocket that I paid. There were also incidental costs like the bras that I got post-surgery, and you know, the pillows and like things I got from myself, which I haven't included in this, but say $21,500, and some of that has been covered. I'm not sure now whether I can make a claim through Medicare to see if any of it's covered by Medicare, but I don't know, maybe I might look into that. I'm seeing my surgeon tomorrow to change the dressings, and I don't know, I think it might be the final. I don't have any further appointments scheduled with her, but we'll see what she says. A lot of people have been asking me who my surgeon is. I haven't said the name because I don't know whether or not I'm allowed to say the name, because, you know, it's just a bizarre thing. Sometimes the haters go after people who have associations with me, and, you know, I don't want to bring her. She's a very, very good surgeon, and I don't want to do anything that might cause any regret. So I'll see whether or not she will permit me to say her name. Otherwise, I won't. So let's talk about the surgery and what went wrong. So, as you know, I had a bilateral breast reduction surgery, and I had some of my lesions removed from my neck. Now, the problem was, like, it was always going to be a big, long surgery because I had a large chest. And after the surgery, which was scheduled on a Tuesday, I was all kind of bandaged up. It all went fine. And then I had 2 drains, one on the left and one on the right. And the next morning it was discovered they were sort of monitoring the right breast, and it just seemed to be swelling, not draining properly. So they're like, we might have to go put you back under. And as it turns out, it's a long story, but basically, maybe I'll draw a diagram. Okay, so let's say this is the normal person's waist, belly button, breasts, right? Now, I had cancer when I was very young. When I was 13, I had cancer. And as a result of that cancer, I had to have radiotherapy. And they treated the radiotherapy by treating a large square, because I had it on my abdominal wall. It's called a synovial sarcoma. It was on my abdominal wall, right? So this entire square here was treated with radiotherapy. So we call that the radiotherapy skin. Now, the radiotherapy skin has always been there, right? It's been there since I was 13, and it's defective. It's not normal skin. This is normal skin. This side normal, this side not normal. And because of that, it's all very, the muscles and the skin is all very tight. A lot of the tissue is gone here. So the draining there's like a gap between the breast and what we call the defective skin. It wasn't draining properly, and it couldn't reasonably have been foreseen that this was going to happen. This breast, fine. This breast the blood wasn't draining properly. And she was saying it's because of the abnormalities in my skin and tissue because of that radiotherapy. So I go back under. They then drain it, all the excess blood, and put another drain in there. So I had 3 drains. And there was like a hematoma they had to get rid of. And anyway, the next day they looked at it again. Oh, and she used blood thinners to wash it out or something. as it turns out, there was an adverse reaction to the blood thinners and it kept bleeding, and I woke up at like, I don't know, 1 a.m, and I was like, it was pitch black in the hospital bed, and I woke up and I could feel all wet, like the blankets were all wet, and I'm like, what's going on here? So I sort of stumble around for the nurse's button. I push it, the light comes on, and this might be confronting, so trigger warning, this is a bit yuck. When I lifted the blankets, it was all blood, right? It was all blood. The blankets were all blood, and it was all just all yuck, disgusting. And I was like somewhat horrified. And so the nurse is like, I'll be right back. So she runs out, gets another nurse, they come back in and they call the doctor. It was like 1 a.m, and take pictures and send it to her, and get the surgeon to say what should be done. So then it was determined that I'd had an adverse reaction to the blood thinners and I needed to go back in. So I did go back in. Was that the Thursday morning? So early Thursday morning. That was the third final procedure where they did everything again and washed it all out and fixed it and fixed the swelling, and then I was okay. So from there I could then, that was the third procedure where I could then start the recovery, which has been going really great. Like, as I said, I've been, I think, fortunate. I haven't had much pain. The nights are kind of long and hard to get through because it's uncomfortable to sleep on your back. But I do have lots of pillows and I'm getting through it. I do have painkillers as well, which I'm trying not to take unless I need to. I've just usually been doing the Panadol. So, yeah, like, I feel like I'm happy that I've done it. It was a really good decision for me. Like, you might recall, like, if I was to sit here pre-surgery, like, you know, my breasts would be on the table because they were so big. It was a J cup. And, like, the, you know, the posture, I'd be like this, hunched over, and it would be very comfortable for me to commonly sit like this because it was just hard on the back. Whereas now I feel so much lighter and freer and, you know, smaller, which is just fabulous. So, yeah, I'm feeling really, really fortunate. It's been a really interesting couple of weeks, and I'm looking forward to the next phase. Okay, I promised I'd do some top tips in case you're looking at having a breast reduction. I've written just 6 things off the top of my head, that things that I did know or things that I wish I'd known. This I did know, but it's a good tip. Your period and your menstrual cycle. So the last thing you want to be doing is, you know, changing pads and tampons and things whilst you're sore or going through this recovery. So align it, as I did, that when your cycle is finished, you then have the surgery for that month, as opposed to doing it, you know, whilst you're recovering, because I think it'd be really hard to have to deal with that every day, whilst if you might be in, you know, might be discomfort and in pain, and it's just one more thing you don't want to be doing when you're in your recovery. So book the surgery, having regard to your schedule, your menstrual cycle. 2, phone charger, good idea, lip balm, soap dispenser, body wash. So when you can have a shower, the best, like when I finally could have a shower, I had like a pump body wash, which my sister brought me to the hospital as a gift, which was such a good gift because I really needed that. Pack undies for the week. I only pack like 3 pairs because I was meant to be in hospital for 2 nights. I packed 3 pairs. I was there for 6 nights. So you don't know if you're going to have complications, so pack as if you are. I should say that hospital quote I got was for 2 nights. That's 7,000, whatever the number was, 7,000 something. 466 was for 2 nights. I ended up staying 6. The fund covered it all. So, gosh, that would have been a really big bill. Button-up pyjamas, bring lots. I brought like 2 pairs, but I was there for 6 nights, and it's really nice to be in your own pyjamas. So pack lots of pairs of pyjamas because you might be in there for longer than you anticipated. Pack some snacks because the hospital food isn't great. Ask your surgeon about the scar. Remember lollipop scar or anchor scar, because the recovery matters which one you get, and ask your surgeon those questions. So that's it. That's my breast reduction conversation. If you've got any questions, let me know. I'm happy to answer them in the comments. Otherwise, all right, I better get back to work. Cheers to that. I'm hoping to, later this week, I'm in court in the city, and I'm going to go and do some shopping for that Chanel jumper. See you later.